Alicia, he said it did. The doctor says he started feeling much better about 24 hours after he got the treatment. He shared with us what it was like to be on the other side as a patient and to have a COVID breakthrough infection.
There were a couple of nights that it was just hard to breathe. So that was the scary part.
Adam Hauser, the doctor, became the patient.
The whole scheme of things, I wasn't as sick as a lot of my patients, but it was about the sickest I get.
Dr. Hauser, who's vaccinated, believes he got COVID from one of his patients. He had fever, chills, and a cough.
Myself and our family are probably stricter than a lot of people, so it was a little frustrating to get a breakthrough case, but I'm still incredibly grateful and thankful that I had the shot because I've had multiple patients who are just as healthy, or if not healthier than I am, that I've sent to the hospital.
When Dr. Hauser tested positive, he decided to fight back with monoclonal antibody therapy. He got an IV of Regencov in his arm. The treatment injects COVID-positive patients with laboratory-made antibody proteins.
That day, I didn't really notice a big difference. I would say the next day, about 24 hours later, I felt significantly better. And I don't know if it was the medicine, the fact that I had been immunized, or just the natural course of the virus, but definitely 24 hours later, I felt significantly better. The fevers were gone, the body aches were gone.
Novant has treated more than 700 patients with monoclonal antibody therapy across North Carolina. Dr. Hauser is glad he followed doctor's orders and got the treatment.
The quicker you get tested and know that you're positive, the quicker you can get it.
Now, the doctor thinks the therapy helped with his breathing. He says after the treatment, he no longer had shortness of breath. He's not sure if it helped with taste and smell. He says he did get his taste back, but his smell is not quite all there. And doctors do warn that this type of treatment should not be used as a substitute for the COVID-19 vaccine. I'm live at Novant Health Presbyterian Hospital. Robin Kennedy, Fox 46.